Next on the agenda, we have House File 3971. Representative Torkelson, do you move that House File 3971 be recommended to be re-referred to Government Operations Committee?
So moved, Mr. Chair.
Okay, certainly. Would you like to present your bill?
Well, thank you, Mr. Chair. This bill does a number of things. First, it renames and reestablishes a advisory council working with water and wastewater issues. The membership of that council is outlined in the bill. It would be an 11-member council. And we have a number of testifiers, Mr. Chair, that would like to testify to this bill, so I'm not going to take much time with it right now. We do have some blanks in the bill as far as appropriations go, and we will, I would hope we would pass this bill out of committee today and take a look at those issues in the next stop. Mr. Chair, I'm going to conclude with that. We have a limited amount of time, and I do want to give the testifiers time to speak their piece.
Okay, thank you, Mr. Representative Torkelson. We'll go right to the testifiers then. We have Ms. Elizabeth Wiffle from the Coalition of Greater Minnesota Cities. If you'd like to introduce yourself and start your testimony, please.
Thank you, Chair. This is Elizabeth Wafel from the Coalition of Greater Minnesota Cities. We are a membership organization of more than 100 cities located out the 7-county metro area. Our member cities operate the water supply systems and wastewater treatment facilities that would be represented on the Advisory Council. We support moving forward with the reestablishment of this Advisory Council. We believe that when the Department of Health and the MPCA work on regulations affecting wastewater and water supply systems and their operators, it is essential that actual operators be part of that conversation. Reestablishing the Advisory Council will bring back an important voice to the regulatory process, and we urge you that you move forward with this proposal. In addition to the council, there are a number of suggested appropriations related to drinking water focused on accelerating and enhancing cost effectiveness plan reviews, facilitating adoption of innovative best management practices, and developing and maintaining asset management plans. Ensuring that our communities have clean and safe water is a top priority for all of our members. We support these efforts because better planning and better practices help ensure our water is safe, but at a lower cost. We hope similar efforts are made with respect to wastewater. Thank you.
Any questions for the testifier? Hearing none, thank you. Our next testifier that I have on the list is Dr. Lucia Levers from University of Minnesota Resource Center. I'd like to introduce yourself and start your testimony, please.
Hello, I'm Dr. Lucia Levers from the Water Resources Center at the University of Minnesota. I'm a research scientist there, and I was in charge of the cost and benefit analysis that was completed on behalf of the Minnesota Department of Health on lead in drinking water. I'd be happy to answer any questions that you all have.
Any questions for the testifier? Representative Torkelson.
Well, thank you, Mr. Chair. I realize it's a little bit unusual that I be questioning my own testifier, but Ms. Levers and I have not had a chance to meet prior to this. It just didn't work out. You know, I believe that Minnesota does a pretty good job with our wastewater and especially our drinking water protection in Minnesota. I think the vast majority of Minnesotans drink safe water, and we do a lot to make sure that happens. But I believe Ms. Levers is especially well-versed in lead in drinking water. Mm-hmm. And I would like her to describe for us how she sees the scope of this issue and how we might best deal with it in the future.
Thank you. Ms. Levers.
Sure.
Dr. Levers,
yeah,
excuse
thank
me.
you. Have to get that right, otherwise my mom gets mad, you know. So to the chair and representatives, lead in Minnesota drinking water usually comes from two sources. One is in the home, which is called premise plumbing, so like your fixtures and whatnot. And the other is from lead service lines, which are the pipes that lead from the home into the street. There are other sources of lead, lead paint, stuff in the soil, various other things. But because water is such a big concern, especially with recent events such as the things that happened in Flint, we looked a little bit more into this. It tends to be more of a problem in older homes. The ones built before 1927 are very likely to still have lead service lines. We estimate there are probably about 100,000 still left in the state of Minnesota. And there's probably about 675 or so thousand homes that still have lead premise plumbing. There's so many more that have premise plumbing because there was still a lot of lead in fixtures and stuff up until about 1986. So it's just a longer time span. So homes that have both are of a particular problem. We estimate that the cost to remove all of those, so the lead premise plumbing and the lead service lines, would be between $1.5 and $4 billion over 20 years. That's over 20 years. It sounds like a lot, but some other municipalities have done this, like Madison, Wisconsin, and Boston, Massachusetts. Now, those costs are to do both premise and lead service lines. So lead service lines in particular are cheaper because there's only 100,000 in Minnesota as opposed to more that have premise plumbing. And it works out to about $2,500 to $8,000 per lead service line. So that's how you end up with those pretty big numbers. However, the benefits are even more substantial, double essentially. So whereas the costs were $1.5 to $4 billion, the benefits would be $4 to $8.5 billion. And those are just the benefits that I calculated based on lost productivity. So lead is a potent neurotoxin, decreases your IQ, which means that basically you end up making less money and you're less effective at your work. So those are just on wages and household work, that type of thing. So that doesn't account for any other type of issues that lead can cause, of which there is a tremendous amount.
Questions?
Thank you, Mr. Chair.
Representative Torkelson.
A couple of follow-ups.
Sure.
My apologies, Dr. Levers, for not using your appropriate title. I'm not very good at that. We recall not too long ago the crisis in Flint, Michigan. Are we at risk in Minnesota of having a similar crisis here?
Dr. Levers.
Thank you, Mr. Chair and Representatives. So that specific cause, no. We don't have the exact same situation that they had, which was very unique and involved a lot of certain infrastructure, certain type of water, and certain missteps. So that's highly unlikely, that exact situation to happen in the state of Minnesota. However, we do have a substantial amount, as I mentioned, of homes that still have lead service lines and premise plumbing. So while we don't have the same situation as Flint, we do have a case where something like lead service lines, which are considered sort of public and private, can be contributing to lead poisoning, and this is particularly a problem in children under the age of 6. So yes and no.
Representative Torkelson.
Thank you, Mr. Chair. Thank you, Dr. Levers. So do lead service lines automatically indicate that there's going to be high level of lead in the drinking water in that home?
Yeah,
Levers.
so, sorry, Mr. Chair and Representatives. Right, so lead service lines, generally speaking, we think if there's premise plumbing that has lead in it and lead service lines, the lead service lines contribute maybe 50 to 75% of the lead in the drinking water. If there's no premise plumbing, they contribute virtually all of the lead in the drinking water in the home.
Thank you,
Representative
Mr. Chair. So, Dr. Levers, that lead that you mentioned is present in the drinking water. Is it present at levels, at high levels or moderate or low? And I realize lead is really a risk no matter what the level is.
Right.
Dr. Levers.
Yeah, thank you, Mr. Chair and Representatives. So yes, there is no safe level of lead. So any amount of lead is dangerous. And again, this is particularly a problem for children under the age of 6, and is a very significant problem for any infants in the home that are consuming bottled milk. That's not the right word. Formula. You could tell I don't have children. Formula that's made with tap water. So yes, there's no safe level of lead. All lead is bad, again, for children. So I mean, we're okay in here, but possibly some other little niños at home would be a problem.
Representative Torkelson.
Thank you, Mr. Chair. Just one final question before we move on. And I'm doing this not so much because I'm trying to educate everybody on lead, but because just educating us to the fact that there are lots of questions around water quality, and we have experts in Minnesota that know a lot about it, and bringing them together in this sort of format might be very valuable. Finally, along this line of questioning, if you live in an older home that has either lead fittings or potentially a lead service line, what should you do?
Dr. Levers.
Mr. Chair and Representatives, that's an excellent question. There's a number of things that you can do. So the longer water sits in contact with fittings and pipes and stuff that have lead in them, the more of that substance it can absorb. So you can remove some of the lead by running your water for a bit of time before you actually drink it. It's better not to drink hot water directly out of the tap. Cold water is better. You can also use a filter. Those remove plenty of the lead as well. The problem with that question is that a lot of people don't know. So they don't know if they had lead service lines. They don't know what's in their premise plumbing, and that's a particular concern for renters who definitely don't have any idea what type of lead service lines or service lines that they have. There's also some concern that people may not understand the risks of the situation. So whether or not they're actually doing some of those remediation or type activities, we don't know if they're really doing those in the home or not.
Thank you, Dr. Levers.
I said it was my last question. I'm going to ask one more. Does anyone track how much progress we're making on removing lead supply lines from our statewide system?
Dr. Levers.
Mr. Chair and Representatives. So unfortunately, we don't have a statewide system to do that. So certain public water utilities have more information about what activities they've been doing. For instance, St. Paul has had a few different programs in the past. For instance, they offered some lower rates to remove lead service lines if homeowners wish to do that while their streets were being repaved, that type of thing. So they have some data on that. But we at the state level don't really know if other public water utilities have had programs in place to kind of do this. But as far as a system-wide program, we haven't had anything in the state yet.
Thank you, Dr. Levers. I appreciate your testimony. Mr. Chair, again, we've just explored kind of one aspect of drinking water. There are many other drinking water and wastewater issues that need attention, demand our attention. We do have experts in the state. As I said earlier, I think we do a pretty good job of protecting our citizens already. I wish we had time to hear from the Department of Health and others within state agencies that do work on this all the time. The University of Minnesota, through their MinTap program, helps communities all across the state maintain their both drinking water and wastewater systems and make them as efficient as possible. All this is good work. There's always more to be done, and I hope that you understand, that the members of the committee understand the value of this particular piece of legislation. Thank you, Mr. Chair.
Welcome. Any further questions from the committee? Was there anyone else left in the audience who would like to testify for or against the bill? Hearing none, Representative Torkelson renews his motion that House File 3971 be recommended to be re-referred to the Government Operations Committee. All those in favor signify by saying aye. Aye. Opposed? Motion carries.